We have an ORA meeting of February 10th, 2025. We have a guest speaker, Isabella Rodriguez. Close up about yourself. What you want to
Yes. Hi, everyone. I think I have the pleasure of being introduced to everybody. It's nice to put a face to the name, Ms. Maxwell. I'm really good friends with Jakia, so I've heard your name speaking so highly of. So, thanks for letting me talk a little bit. I thought y'all were probably the most important group that needs to hear this information. So, I have been researching probably the past 3 weeks about Oklahoma's Medicare. So I'm going to be so ready for when I retire or when my mom retires because I know a lot about Medicare, Medicare Advantage, etc. But the reason why I started doing this research is because a lady who's a retired physician out of California reached out to President Jimmy Curry. And I guess, 15 years ago or something, they were working on some congressional bills together. That's how she had his contact. So she said, hey, I'm building together a coalition of people from every single state that is affected by this big issue. Can you guys, have somebody sent to the group? So Curry delegated it to me, and when I dove into this topic, what they were covering was this new thing that's happening. It's not like a bill that's going to be voted on or anything. But you all probably know what CMI or CMMI or CMS stands for, Center for Medicaid and Medicare Services. They have issued a new pilot program. So they're testing it, right? For 6 states in the U.S. starting January 1st, 2026. Oklahoma, Texas, Ohio, Arizona, New Jersey, Washington State. Okay? These 6 states are going to pilot, test a program where AI will be in charge of determining if a person who's using traditional Medicare can get, traditional Medicare only has about like 15 to 18 procedures or services that need prior authorization. Medicare Advantage has like 89, right? So Medicare Advantage, you usually do prior authorization a lot, right? But with Medicare Traditional, which most Oklahomans use, okay, people over 65 and people with disabilities, 60% of those people in Oklahoma only use traditional Medicare, or that's their primary, and they supplement with something else. Because we are so high usage, that is why our state got chosen. We did not sign up to say, hey, we have a lot of people who use this and we think that they're all wasteful and committing fraud and that they don't actually need those services. We didn't say that. We got chosen because of how many people use traditional Medicare. And that's just in Tulsa and Oklahoma City. But as soon as you get out of those metro areas, that number jumps up to 70%, right? So, we have so many people who are going to be affected by this AI company. We can't find who these companies are yet, which is extremely concerning, right? But because this goes through like a rules process instead of like voting on a bill and through Congress, that they don't need congressional approval. So the end goal is to have all states have AI making the decision if you get authorized for that procedure or not. The worst part is that the American government is going to pay this AI company, which is usually CVS, Humana, or United Healthcare, because they come up with their own AI to further get profits. Those companies are compensated. Say the American government says, we want to test you out, and the way we'll pay you is based on the percentage of services that you deny. So there's no incentive for those companies to approve anybody. So where we are right now is this coalition is a lot of retirees, a lot of just like active retired physicians, doctors, and things like that. And so I'm one of the only union people people or, organized labor representatives there. So I said, what are we doing with our state legislators? What are we doing with this? How are we doing that? And they just don't have, this small group of people don't have the capacity to, make social media campaigns or things like that. They're doing a lot of letter to the editors, which I have brought some examples for you guys because I know you guys are good at that. And I would love if you all could take a look at some of these things, maybe tailor it to Oklahoma a little bit more, and then maybe Oklahoma or some other areas, because we want, the end goal is for our Republican state legislators to be able to know that this is a big enough deal that they have to go talk to Langford, Mullen, and all them. So I've already talked to the leaders of the Democrats, and we have agreed. I said, I want you to know about this, but I don't want you to be the ones to say anything about it, because then that makes it look like this is a liberal issue when it's not. So our goal is to try to build up support so that we can reach our Republican state legislators to elevate the issue to Congress. It is a ticking time because it starts January 1st. There's a resolution that's been filed from a guy in Washington that our state, our congressional people can sign on to, but it doesn't have any teeth, right? But I wanted to bring this up to you guys because it's going to affect us so much. So I brought a couple things for you guys. I'm going to do it in a form of an email that maybe Tim can send out to everybody in the group, or I know whichever way is easier to get it to you all. But I have paper copies and stuff.
I'll give you that ORA email soon.
Okay. You want me to send it to the ARA email?
Yeah, I think so.
Perfect.
You
Because
can send it to Brian too.
it has, one of the best things that I was going to give to you guys was a YouTube video. This lady who first reached out to me, she spent time being a professor, and so she can't help it. She made an hour video explaining the history of Medicare and then how this particular AI pilot is going to affect everybody. It's really good information. It is really long, so instead of a movie to end your day, you could turn on this YouTube video, so I'll make it real easy for you guys to click onto it. But the biggest thing that I learned from that video is that this model, this AI pilot, is called Wiser. All these conservative groups, they are really good at messaging. Shouldn't we do the Wiser thing? Shouldn't everybody have a right to work? It's the same thing. That insidious name, it's not true. It's actually hurting Oklahomans very much. But the biggest thing I learned from that video is that the American government last year in 2024 overpaid these companies that administer Medicare and Medicaid $84 billion. I'm sorry, but the percentage of people who are using traditional Medicare across the whole country, even if we never let them ever have a service ever again, it would not save as much money as $84 billion that we handed to these companies last year. So anyway, that's just me going a little dramatic, but I have some letters to the editors I would like us to, see if we feel comfortable, raising those up. And then I'm going to make a template of a letter that I'd like you all to send to your congressional offices too. So we might as well start, raising the issue. Be like, did you hear from your constituents about this issue? We've been trying to get in contact with you. So that's the hope. National AFL-CIO has been really helpful with us. They have produced, which I'm happy to share out with all of you, AI and Oklahoma healthcare, a one-pager with how this is supposed to work, when it's going to work, and how it's going to affect us. But I asked them to make this for our Republican state legislators because it has some solutions. It has some other bills that other states have filed where it's we're not going to do something just because the federal government says so. And that's tricky. I don't normally like those kinds of things because it's usually for a good federal government initiative, but in this case, it's not. And so we have that option if they want to do that. But this has all the sources as well research compiled. So I would like to pass that one around. This one can go this way. Does anybody have any questions right now? Because I feel like I just word vomited.
Yes,
Do you have that in digital format?
Yes, sir. These are just paper, but I will get digital to everybody.
You said that they could divide some subjects, right? So, people like me, I have secondary insurance. That's gonna make, that insurance skyrocket.
That I don't know, but I could safely assume yes.
My supplements, mine and my wife's supplements gonna cost us combined about another $80 a month.
I believe on Medicare, if Medicare won't cover a procedure, your supplement won't kick in.
Right.
Oh, well,
Back, I've been retired while I was still at work, we had Blue Cross and Blue Shield. We call what she's calling a gatekeeper. And what they did, they sit at the desk and they went to, and Gerald was a doctor, he said he needs an arm replacement.
Yep.
They would go and look at it. Oh, they don't. It was and this is all it is. All they do is saving the company's money, and that's what they did. We put up with that with Blue Cross Blue Shield for 3 years. I don't know if you were at Oakland City Work for me. What did you have to have? I don't know, 92 when I retired. But anyway, so all they're doing is they're having. It's just like we call it, a gatekeeper. He would make all the decisions. Dr. Whoever is set up to take care of that, they say yes or no. And like we said earlier, if it's not approved, then the insurance company not going to pay.
Yes.
Was there any discussion that if the AI generated review denies a procedure, is there an appeal process in place at all?
I think it's the same appeal. That's another thing I was going to say. We're building a coalition to try to pause the implementation January 1st, but if we are unsuccessful and it starts January 1st, the main thing that this group has been advised to tell people is that when you get denied, you appeal but it's like your doctor has to appeal.
Right.
And so usually if they appeal it reversed, that's the issue, right? Is that instead of a human being this gatekeeper, it's an AI robot. And so at least in this situation, you could have called that person to appeal, and now there's no human to a choice like that to
But it
fight
was
with.
very seldom that it was ever reversed.
Exactly. So I think that the appeals process is similar to how it is now. That's what they made it seem like, that they're not changing that, but the human element is gone. So,
And your head, it's going to go to the pot.
because you could argue with a human's choice, but when a robot is just using data, that's a lot harder to fight against, I guess.
that is some information for all of us, colleagues.
It's called Wiser. Wiser is this name for this program, this pilot program. So have you heard about Wiser? This video that I'm sending y'all is Wiser is not wise. We're just trying to get the name out so that people are more aware of it. So I will send all that in an email to you guys, and if you could share as much as you can about it, and then I will keep you all updated. But I have a call, I think tomorrow and next week with National AFL-CIO, because they want us to really start the fight. I was asking them, I said, we don't have that much time. Should I be planning to be responsive, or should I be planning to try to attack this? And he said, no, the attack is starting, so we are starting to fight. So from now until the end of the year, we will be making a lot of noise about this.
So how long is this trial?
That's another good question. He said, how long is this supposed to last? The pilot program, 6 years. Okay, but let's just look at the time. I don't have a watch on, but AI came out in 2023. It's only 2025, and we've already seen how fast it changes. The fact that this AI pilot program is 6 years long is very concerning because we've already seen that the AI technology could change 3 times over in that time. So there's not a lot of details on if they are going to keep the same model or if the model is going to be learning as it goes, or that kind of thing. So it's very concerning.
Are they gonna, at January 1, are they gonna be making decisions, or are they just gonna study and look at all of them?
They're making decisions January 1.
Right. Who's they?
Like,
The Center for Medicare and Medicaid Services, CMS.
and they control who operates your Medicare or Medicaid. So like, United Healthcare, Humana, etc. Right? They answer to those people. That's it.
Only to
What I
cut,
do know is who appoints this?
In theory, it's supposed to be one of those independent agencies like OSHA or something, but we have seen how they, have given up their.
You could appeal to the Secretary of, Kennedy.
Robert
Congress
F.
office.
Kennedy is the
Health and Human Services.
yeah, he's a good guy involved, he's got more.
Oklahoma, Texas, Arizona, Ohio, New Jersey, and Washington.
Any of those bills that other states are writing just say we don't want it, that's it, cut it off?
It's a resolution, and that doesn't have any teeth. That's the problem.
Has anyone talked about that? I'm sure somebody has, but like
I'm not.
raising the awareness to the House Oversight Committee, the U.S. House Representatives Oversight Committee.
I don't know. I haven't heard that from this group, and I don't know if this group that have reached out to me even has any way to accomplish that.
Well, I would just think, maybe, I don't think you're going to get anything back from the chair of the committee, Comer. But what about Robert Garcia, who is the ranking member in Congress on the House Oversight Committee? Not that he's not already bombarded with lots of problems, but I would definitely, at least somebody should have written Congress a letter and said, hey, did you know we're turning over decision making to artificial intelligence? Because there's so little reins, either federal level or at the state level, on artificial intelligence and it infiltrating. I mean, it's already here.
Right.
There's no backpedaling. It's just, we've got to have some kind of policy, and with Congress's inability to act on about anything right now, people are going to have to rise up to demand that there are some gatekeepers and some control put on artificial intelligence, or we can all just become cyborgs
Right.
pretty soon.
I will ask them. I'm supposed to call the lady who's heading that group today to talk about stuff that I missed last week from convention. So there's more to come. I'm pretty nervous about it. If we don't stop it, then just everybody needs to appeal their denials. But another thing that was
Marjorie Taylor Greene's on the House Oversight Committee, so
okay.
call her.
It could be. She said some stuff that I don't hate, which is crazy.
Yeah.
Yeah.
Well, at least she did agree with all Republicans on this.
Okay.
She's trying to see what
No, you're fine. Oklahoma retirees, it would be really helpful if you all could write a letter to your state legislator as well as your congressional legislators, asking if they could dig deeper into why Oklahoma was chosen for this, and can we pause this implementation? Because from that video, one of the most insidious things is that, United Healthcare, Humana, and CVS, they already have models that are like AI programs to do the prior authorization for Medicare Advantage. And the House Investigatory Committee found that when those companies denied Medicare Advantage procedures, that 80% were actually overturned. So they were denied 80% of the time for things that they should have had. And when we dig deeper into what those denials were, it was acute care, which I didn't know what acute care meant, which is like if you go into the hospital and then you have to go to an assisted nursing home facility, or God forbid, a physical rehab place. They were getting denied such a high rate of those things that created immediate death. There you have the number of how many people died because of this faulty AI decision. Because it wasn't supposed to be denied. 80% of those denials got overturned and they weren't able to do it. But how long did that denial process take that they were not able to get that intense care, and then they died? So I'm laughing because it's so horrible. It can make me cry. Like I don't understand why this is flying under the radar so quickly.
So many things related to artificial intelligence are flying under the radar because people don't know what to do, and there's so little regulation on it.
Absolutely.
So, I mean, it's not like it's against the law to use a computer program to enhance, the administration of government programs. That's not against the law. It's just there's no regs related to it at all.
Yes. And the companies, the private sector
Yes.
is who is developing AI. And if you think about those like tiny, minute biases that a company would have rather than a government holistic, we're supposed to take care of people instead of it creating more profits. Just that baseline.
It seems like there's more of an example of us losing more and more of our health benefits.
Exactly, that's what it is.
For me, I cannot fathom why do we want everybody sick? How does that?
It creates more money for.
It's a matter of money, greed.
So,
If everybody's sick, it's gonna cost more money because you still have to treat them.
Hey, it's cheaper to let them die.
Yeah.
Save money.
line for ORA, giving out information.
Yes.
If want to contact you,
Absolutely. Please feel free to share my contact information.
do it right now.
Yes, if you have more questions about this AI in traditional Medicare in Oklahoma, feel free to call the Oklahoma AFL-CIO at 405-528-2409. And my email is Isabella, Isabella, @